The union for staff at the Hawaii State Hospital says it's considering filing a grievance over unsafe conditions. Hawaii News Now has learned the hospital was far over capacity this past weekend. As Daryl Huff reports, advocates say dangerous people are still on the streets.
Overcrowding is nothing new at the state hospital, with inadequate treatment available in the community and a revolving door of criminal defendants being sent by the courts for evaluation. But now the union for the workers here says it's an unsafe environment.
The census is extraordinarily high, tensions are high, and we are getting an increased number of calls from employees. They're reporting incidents of assault, incidents of challenges with the patients.
Sources say there were 387 patients in the hospital this weekend, and there are more staff vacancies and absences, making it harder to supervise the excessive patient load. HDEA represents nurses and professionals whose contracts guarantee a safe workplace.
And we will pursue some kind of litigation if necessary to address the safety and health of the staff to make sure that the hospital takes every precaution possible.
I'm hearing that the staff is terrified.
Civil rights attorney Eric Seitz has sued the state before on behalf of patients and to have overcrowding addressed by federal civil rights agencies.
Under the current administration, that's not possible any longer. Civil rights don't seem to matter to Mr. Trump and his colleagues. So we have to do it ourselves.
One issue for both lawsuits or grievances is getting details of the situation. The union has demanded reports of violence against staff.
At this moment, things are moving pretty slow. And there's been some comment from the hospital that they don't keep such statistics, which we know is not true. You know, they keep track of folks who are assaulted.
In response to our questions, the state provided a chart that shows a similar number of patients were hospitalized last summer, about 390 for 3 months, and says up until January of this year, assaults were trending down. The state didn't provide more current numbers, but advocates say they definitely haven't solved the issues.
The state now has probably one of the worst mental health systems in the country.
Seitz says because there's no room at the hospital, defendants who need treatment are backing up into the jails or being released to the streets without needed treatment.
It's not just taking care of patients, it's making sure that people with serious mental health problems are not roaming the streets, and that's a real danger.
While the state tries quick fixes to keep patients and workers safe, in the long term, it's going to take a lot of investment, money, to fix the problem. Reporting from the State Hospital, Daryl Huff, Hawaii News Now.